you were in today for a failed hearing screening. Are you concerned about your child's hearing at all?
Not really personally concerned, but the school wanted us to get it checked out.
Okay, great. Has he ever been tested before?
I believe when he was a baby.
Okay. Is Tim responding to environmental and speech sounds?
Yeah, he seems to do a pretty good job, especially now that him and his sibling are playing more.
Mm-hmm. Great. Is there a family history of childhood hearing loss?
Not on my side or his dad's.
Okay, awesome. Do you have any concerns regarding Tim's speech and language development?
No, he seems to be keeping up with his friends' language
Mm-hmm.
and their peers, so I think it's okay.
Okay, great. Is he combining words and sentences and phrases?
Yeah, so he's doing a pretty good job of that, I think. Again, he seems to be matching his friends with that ability.
Mm-hmm. Awesome. And is he following simple directions?
He does if we can get his attention. Sometimes we have to call him a few times, and that's really the only place that I might have a concern.
Mm-hmm. So just in general, how do you feel about his overall development?
Good, I think he's progressing pretty well. He's a super active kid, so that's really nice.
Mm-hmm. Absolutely. Okay, so was Tim carried to full term?
He was.
Awesome. Were there any complications during pregnancy?
No complications.
Okay. Any medications at birth?
None for myself or Tim.
Okay. Jaundice?
Nope.
Okay. And did he pass his newborn hearing screening?
I believe he did.
Okay. And let's see here, has he ever been diagnosed with any medical conditions?
No medical conditions that I can think of. We do wonder sometimes, because he has a hard time paying attention, if he might have ADHD.
Mm-hmm. So how does he act at school? What are his parents saying? I mean, his teachers?
Well, his teachers say that he is distracted really easily, and they also have a hard time getting his attention, and they're trying to find some solutions for that too.
Mm-hmm. Are they finding any solutions that are working, or just, how's that going?
I think so. I think they're kind of wanting us again to like rule out that there's no hearing loss or something going on with that first before they really make any big changes, but the teacher's just been trying to like get his attention before they start something new.
Okay. Great. Okay. Is he taking any medications, any supplements?
Just multivitamins, no hard medications or anything.
Okay. Has Tim ever had any ear infections?
He did. He had a handful when he was younger, about like, maybe 2-ish, when he was 2-ish years old.
Okay, great. And would you say that is the last time he had an ear infection?
Yeah, he was definitely around 2, and those were treated with antibiotics.
Great. Did he have any tubes?
No, we haven't needed to do tubes since it seemed to stop.
Okay, great. And has Tim ever had any ear injuries or head trauma?
Other than general roughhousing, he's been pretty good.
Okay. What about eye and dental exams?
So he did have a vision exam at school, but we haven't done any dental exams.
Okay. Is there a family history of childhood disease?
No.
Okay. And is there any additional information you'd like to share?
Not at this time. He's just a very active kid.
Okay, great. Okay, so now I'm gonna name my FDA 8. So, unilateral hearing loss within the last 90 days, sudden or progressive hearing loss within the last 90 days, drainage within the last 90 days, ear deformity, ear pain or discomfort, foreign body or significant cerumen in the ear canal, acute or chronic dizziness, and an air bone gap, equal to or greater than 15 dB at 500, 1000, or 2000 hertz. Okay.